Hey, Stroke Boy, where I'm going to show you my trials and tribulations and how I navigated from having a catastrophic stroke that my doctor said I should have died, and how I've recovered and exceeded all the doctor's expectations. It is very difficult in the beginning because if you're like me, you're very active and doing everything in life, and all of a sudden, for me, I was paralyzed on my entire left side. Nothing moved. I couldn't drink out of a glass. I would choke if I didn't drink thickened fluid. Um, Another thing, going to the bathroom with a bowel movement was very difficult. It's very important as we go through these things, I'm going to teach you how to avoid a lot of the pitfalls I suffered because nobody came out with a stroke handbook and said, this is how you get better. I'm sure right about now, you're laying in the hospital bed thinking about how am I going to get through this? You just suffered a devastating event, and what you need to do is just break it down like a math problem. We're going to take one step at a time, and we're going to work on one thing. When we get that done, we're going to progress to the next thing, and pretty soon we're going to build all these building blocks, and it's going to be amazing how you recover. Not only is the stroke physically devastating, it's also mentally devastating. It is hard for people to figure out and how they're going to cope with their new life and how they're going to get out of the hole that they are now in. It is so important to talk to people, tell them how you're feeling, tell them your concerns, tell them your goals. And I found for me that if I have a goal, that really helps me push on to get out of that mode of thinking that the world is ending. And we're going to talk about day one in the hospital. So you've had your stroke, they've stabilized you, and now starts the hard work. And I have a couple tricks that will aid you in not injuring yourself. And another important thing while you're in the hospital, people are going to be well-meaning, and the hospital personnel are going to want to move you around on the bed, and you cannot let them pull on your affected arm or leg if you have no ability to move it. Because if you do, that will damage your arm or leg, pulling the muscles, stretching the muscles and tendons, which that happened to me on my left arm. My son wanted to help, and the nurse was moving me on the bed, and I said, do not pull on my left arm. However, he pulled on it, and my left arm stretched and then dropped 2 inches out of my shoulder socket because I could not pull it back. It was extremely painful, and I'll go over that in more detail. This is day one. You're in the hospital. You're probably super exhausted, so it's maybe day number 2, but it's so important to start moving all your limbs, fingers, toes, legs. So what I'm going to show you is the first thing to do. You probably only be able to do 1 or 2 of them because you'll realize how heavy your arm is that's affected. But what you want to do is you want to interlace your fingers, and then you want to extend your arm all the way out till the left arm is straight, and then you're going to do triceps gently touching the top of your head. Your goal is to do 20, but in the beginning, you're just going to do as many as you can do. You're going to find your non-affected arm is so exhausted it can probably maybe do 5. The next thing you want to do is you want to stretch your fingers out like this to where they're completely straight, and hold it. Get your wrist full flexion, and then you want to take your wrist and bend all the way down. So important to do that, as well as rotating your wrist, but your arm doesn't stay up, so it's difficult to do. And once you do that, do both directions as best you can. Then what you're going to do, once you've extended your fingers, that you want to compress your fingers into a fist, and do this several times a day. You can do it while you're in your hospital bed by yourself. So important to have the fingers have full range of motion. The next thing you're going to do is you're going to do your leg. Now you can't do that by yourself, so you have to have someone lift your leg up, bend your knee, and bring it back to your chest, and then put it forward, and do that like at least 5 times, a couple times a day. Then you'll do the ankle, the same thing as the wrist. Have someone rotate the foot because you will have no movement in it. And also do the toes. Have them curl all the way down. Let people manually manipulate your toes all the way curled and then all the way extended. Then another thing to ask the hospital staff for is a washcloth, so you can just practice. Your hand will not hold it, but just practice putting that in your hand and working on your sense of touch. Another thing that happens to a lot of stroke patients is after the stroke, they don't have any sense of touch or sense of feeling. So say in my case, my entire left side was affected. However, I had sense of touch or sense of feeling. And I had a nurse come in and I asked her to raise my left leg with some pillows because of my blood clot. And instead of setting my leg down, she dropped it. And I told her, ow, that hurts. Well, she goes, you felt that? I said, yeah, I can feel everything. I just can't move it. She goes, oh, I'm sorry. So just let them know that you have sense of touch, or have them be careful, because it is a strenuous job to take care of a stroke patient. This is how my arm was injured. They wanted to reposition me on the bed, and my son was there and had nothing but the best intentions, but he started to grab my arm because they wanted to pull me more on the center of the bed, and I told him, do not pull on my arm because I cannot contract my muscles and tendons. He pulled on the arm, and that's where I ended up having a separated shoulder from my arm. So make sure that you tell them not to pull on your limbs. You can use your arm and your only good leg to move around. It's very difficult, but do as much as you can yourself, and that will minimize injuries. If you do have an injury, do not allow them. Sometimes they'll ask you to roll over on as they did with me, my sore shoulder. They said, roll over. I said, no. And one time the physical therapist did have me do it, and it hurt for like a week. So do not do things that you know you're going to injure yourself. Tell them, no, I can't do that. Okay, another thing that's really important. What happened to the body once it had a stroke is that it had a catastrophic event, and you went from being an active person to an inactive, paralyzed person. And the problem is you must eat. You have to eat a lot. I was eating every meal, and within, I think, 20 days, I lost 25 pounds of muscle. So I cannot stress this enough, how important it is to eat and do as much exercise as you can, because it will be amazing how much atrophy you get. Make sure you stay hydrated, drink a lot. They're going to give you a cup with a straw. You may spill it on yourself, it's okay. Just constantly hydrate. So that way your bowel movements will be much better and you won't have any other problems. One thing we're going to talk about is pooping. So day 1 of your stroke, you're inactive. You're not moving. You probably can't roll over on the bed. You're just laying. And the body, it is now hard for it to process the waste as you continue to eat once you ate yesterday before the stroke. So I highly recommend starting to take a low dose of Marilax or Senecot or whatever the hospital recommends, so it is easier to go to the bathroom. Because if not, it will be extremely painful and you don't even want to go there. You're going to learn that the Stericetti, and you'll learn what that is what they get you on to go to the bathroom, and it is very difficult. So you really want to be ahead of the game here. We survived our stroke. We're now progressing to recovery. So we've gone over exercises, we've gone over using Marilax, we've gone over setting goals, we've gone over talking to people when we're feeling depressed and how we can cope with that. We're learning how to cope with our brain, which is not working like it did the day before, because it's been severely damaged. However, we're going to get it back. Okay, I'm not saying goodbye because I'm in it to win it. So I will be back with the next episode to continue with your journey and to help you be successful. Look forward to seeing you.